Variant FactChecker is a service offered by the Center for Genomic Interpretation to help you better understand both the evidence and significance of your genetic test result. We know that everyone has genes, and that everyone's genes have differences. These differences are called genetic variants. Most of these variants cause no harm, but some do. Genetic testing can help you and your clinician decide what clinical action is best based upon the presence or absence of specific genetic variants. When your clinician orders a genetic test, they are trying to find evidence for a hereditary disease in your family. The process is fairly simple, and in some parts of the world, including in the United States, some tests can be ordered online without directly contacting a clinician. First, you give a sample of your blood or saliva to be sent to a laboratory. The laboratory extracts your DNA and classifies any genetic variants. This means that a clinical significance is assigned to each genetic variant found. The laboratory then issues an official clinical report. These reports may have a variety of different conclusions, leading to different medical outcomes. Sometimes a person's genetic test will report a variant of uncertain significance, or VUS. This means the laboratory did not have sufficient information to determine if the variant increases risk for disease or not. Some VUSs are eventually discovered to increase risk for disease. However, most are eventually determined to be benign, meaning they do not increase disease risk. Positive genetic reports received by those with a variant that increases the risk of disease most often have conclusions such as positive, pathogenic, likely pathogenic, deleterious, suspected deleterious, risk factor, or carrier. You should always discuss with your healthcare provider what medical treatment options are best for you. As with all cutting-edge science, it takes time and effort for scientists to agree and adopt variant classification methods. This is why, for any given variant, you may receive a different classification from different labs. Due to recent data, we now suspect that many hereditary diseases, patients who receive positive genetic test results may too frequently receive a false positive. That is, their genetic variant was interpreted to cause disease when it truly does not. These false positives can lead to anxiety, distress, and incorrect medical treatment decisions, such as organ and tissue removal, termination of pregnancy, or unnecessary therapies with harmful side effects. To avoid false positive classifications, a stricter standard of evidence is necessary. The Center for Genomic Interpretation uses a rigorous approach to genetic variant classification. This scientifically powerful method is best suited to situations where a positive genetic test result prompts a life-changing decision with irreversible or traumatic clinical action. Variant FactChecker uses this comprehensive classification method to empower patients who have tested positive for harmful variants or who have received a variant of uncertain significance. CGI helps patients make more informed decisions with their clinician. Variant FactChecker puts our world-class scientists in your corner as your personal research consultants. If you have received a genetic test report with a VUS or a positive variant, contact us to obtain an independent, research-use-only expert evaluation that considers all of the available evidence. For questions or to order the Variant FactChecker service, see our website, genomicinterpretation.org, or contact us at info@genomicinterpretation.org. It's always good to have a second opinion.